Yan, magandang hapon sa ating lahat. Welcome to our panel discussion this afternoon. So we'll just wait for people to enter the room. But while we're waiting, feel free to introduce yourselves in the chat. No, let us know where you're from. Kung anong institution kayo galing. No, yeah. So we'll just wait for everyone to come in, and we can all just do that in the meantime. Ayan, mayroong nag-chat. Hi, Marinette Cabading from Mariano Marcos Memorial Hospital and Medical Center from Ilocos Norte. Thank you for joining us. Very exciting. I'm looking through the chat. I know there are some DLSU behavioral science undergrads joining us this afternoon, no? Again, if we're just waiting for more people to enter the Zoom, the webinar, no? In the meantime, feel free to introduce yourself, no, in the chat. Let us know where you're from. You can greet each other. Happy Pride, no? Happy Pride, everyone. Yeah, and then we should start in like 2 minutes or something like that. And hi, Christine Joy Soler, from Capiz State University, Rojas City campus. Hi, good afternoon. Thank you for joining us. Hi, good afternoon, Maricel. Yeah, thank you for joining us. We have Carla Añano from National Children's Hospital. Thank you for joining us this afternoon. Yeah, good afternoon, Araceli. I hope I'm saying your name correctly. From Capiz State University. So a lot of people from there. Thank you for joining us. We're excited to have you. We have, a lot of people are saying hi, hello, hello, happy Pride, everyone. Ay, nawala yung chat sa akin. Okay. Okay, we have sent someone from Central Philippine State University. Hello, from the Anti-Drug Office, Drug Abuse Office in Los Baños. Hello, Sean from DLSU. We have someone from DepEd, Cabancalan City, Negros Occidental. Right. Wow, okay. That's exciting. We have a lot of people joining. Yeah, right now we're at 75 participants. Wow. Hello from everyone. All right, I guess we can start, no? So we have a lot of people. But yeah, magandang hapon sa ating lahat, no? Good afternoon, everyone. Happy Pride. Welcome to this afternoon's panel discussion, no? On the state of LGBTQIA plus health in the Philippines. No, I'm Luis Abesamis. I'm a behavioral scientist. I'm also a graduate student from DLSU and a research partner ng UP Center for Women's and Gender Studies. The center wanted to host this panel discussion this afternoon, no, because we wanted to like get updates on what's happening when it comes to LGBTQI plus health in the country, no, because when we talk about the LGBTQ plus community, the health aspect of it is sometimes talked about, or it's always talked about in respect to like HIV and AIDS, in respect to mental health, or yung experiences sa West, no? So for this Pride Month, no, you invited representatives of policymaking circles, community-based organizations, and the academe, no, to discuss. Magandang hapon, Doc Natsi. Welcome to our panel discussion this afternoon. So before we begin, no, I just want to let everyone know that this webinar will be recorded and uploaded to the center's YouTube page. No, so after the webinar, if you would like to revisit the talk, you can go to the YouTube page. Make sure to follow the center's Facebook, Instagram, and Twitter to keep updated when the session is up. And later on during the panel discussion, if you have any questions for the panelists, no, feel free to share them using the Q&A feature of Zoom, not the chat, the Q&A feature of the Zoom. No, so you can use the chat to introduce yourselves, to greet one another, and then for questions, we'll use the Q&A. To formally welcome us this afternoon, no, we have Brian Senga, the SOGSC consultant of the UP Center of Women's and Gender Studies.
And hello, good afternoon, everyone. Thank you, Luis, for the introduction. I would first like to greet everyone a happy Pride, happy Pride, everyone, and of course, thank you as well for coming to the center's actually second webinar in line with the Pride Month. No? Last Monday, we learned a lot from Victoria on urban LGBTQI activism here in the Philippines. And for today's webinar, for today's video, we will be talking about LGBTQI health. No? And this is actually, siguro mention ko na lang rin, no? It's actually the brainchild of Louis here, our moderator, a fellow young scholar who's also now working on a lot of research on the said topic. And we really appreciated when he came to us, especially as I'm also someone who's working with a lot of LGBTQI organizations, communities, advocates. So I know how little there is when it comes to mainstreamed knowledge on LGBTQI health. Oftentimes, we find ourselves as advocates, facing the glaring gaps of our health initiatives. And sometimes these feedback pa would come from communities themselves. Naalala ko meron kaming parang consultations siguro last year, but I think, or 2 years ago. Usually kasi we come with frameworks, no? Nag-identify ng key populations. And I just remember this trans man from the community saying, nasaan kami sa diskurso nito? So, magandang mapag-usapan yung mga ganung bagay na sana yung mga participants din makapagtanong, di ba? Ng mga gusto niyo itanong. So yeah, we think that these issues, concerns, and overall discourse about LGBTQI health should be brought more into the light, which is why we set up this event. Now, we invited here individuals from different fields, me from DOH, from the academe, of course, my dear friend Magda from Curls. And we hope that our conversations with them can lead to very productive possibilities. Diba? So with that said, I hope everyone would really pay attention, again, ask a lot of questions. And again, maraming salamat and happy Pride.
Yay, maraming salamat, Brian. No? Yes, I do hope no, na ang conversation natin this afternoon will inspire a lot of our audiences no, to engage in, like what you mentioned, no, productive possibilities. No? Let's not waste any time. Let's get straight to it. No? Let me introduce first no, our panelists for this afternoon. First, we have Miss Martha de la Paz. She is a public health practitioner and LGBTQ plus health advocate. No? So after graduating from the Health Sciences program of the Ateneo de Manila University, she pursued public health in the Department of Health, focusing on health policy development for the implementation of the Universal Healthcare Act and COVID-19 response. Now, she's also one of the inaugural fellows of the Samuel Rose Tumo Memorial Fellowship for Global Health of ThinkWell, spearheading the institutionalization of LGBTQI plus health in universal healthcare. Hi, Miss Martha.
Hi, Louise. Thanks for having me here.
Yeah, excited to have you here. Next, we have Miss Magdalena Robinson. She is the founder and chairperson of Cebu United Rainbow LGBTIQ plus sector, or CURLS. No, she is a transgender rights activist and is passionate in the inclusion, equity, and equality cause of the LGBTIQ plus community. She has experience implementing the anti-discrimination program in Cebu City, lobbied the anti-discrimination ordinances of cities of Cebu and Mandaue, and is now busy in pushing for a SOGIE equality ordinance in her locality to provide a mandate for the sector's development program and source its fund from the GAD budget. Hi, Ms. Magdalena. Oh, you're muted po.
Hi everyone, happy Pride, and thanks for having me. Actually, the SOGIE Equality Ordinance was passed just 2 days ago.
Yay,
So yeah, happy Pride
congratulations
to
po.
everyone. So may 3 million budget na kami for coming from the GAD Fund.
Wow,
Yeah,
congratulations po.
happy Pride indeed.
Yeah, happy Pride indeed. Finally, no, thank you for being here. Finally, we have Professor Laufred Hernandez. He's a professor at the Department of Behavioral Sciences, College of Arts and Sciences in the University of the Philippines, Manila. He's also presently the chair of the said department and the Faculty of Health Policy Studies, Health Social Science Cluster. He received his undergraduate and graduate degrees from the University of the Philippines, Diliman, Quezon City, and he also received his second master's, a master's of arts in medical anthropology from the University of Amsterdam, the Netherlands, and he is presently a candidate for the degree in Doctor of Philosophy in Public Health, majoring in Community and Reproductive Health from Chulalongkorn University in the Kingdom of Thailand. He was a Fogarty Fellow for HIV and AIDS at Brown University and a European Union Fellow for HIV and Development at University of East Anglia in Norwich, United Kingdom. So Professor Hernandez has been in HIV and AIDS work, advocacy, teaching, training, and research since October of 1987. He was one of the pioneers in HIV research centering in men's health, particularly among male seafarers and established-based male sex workers. And in 2004, Professor Hernandez and other colleagues from UP Manila published a research work on formative assessment of HIV and AIDS among men who have sex with males, or MSM, nationwide, and predicted that a significant increase of HIV-infected Filipino MSM will happen between 2005 and 2009. Further, Professor Hernandez led a team to pretest the Integrated HIV Behavioral and Serologic Survey, or the IHBSS tool, no, exclusively for MSM nationwide in 2003. And among his active researchers to date, he is the principal investigator for HIV and AIDS intervention designed for trans women in the Philippines. Professor Hernandez says areas of expertise are in health policy, quantitative and qualitative health research, sexual and reproductive health of men, sexualities and identities, and ethnopsychiatry. Professor Hernandez has been actively partnering with HIV frontliners such as NGOs since 1994. Welcome to the panel discussion, Sir Laufred. Oh, you're muted po, sir.
Salamat sa imbitasyon. Happy Pride, everyone.
Happy Pride. We're really glad to have you all here. Thank you very much for accepting our invitation, no? And I guess we can jump right to it, no? I guess when we talk about the state of LGBTQI plus health in the Philippines, the first question that comes to mind, no, is what are the pressing issues right now, no? Pressing health issues for the LGBTQIA plus community in the Philippines. And I guess we can start with Miss Magdalena Robinson, no? Get the community's perspectives, no? What are the emergent health issues?
Actually, it's not emergent.
Mhm.
Maybe it was given light due to the threat of HIV to the LGBTI community, specifically.
Oh, Miss Magda, your audio is lagging po. Ayan, welcome back po. You're muted. You're back.
Yeah. So actually, parang pumasok lang talaga yung attention in LGBTIQ plus health, specifically when it comes to in HIV response, no, because of the key population of MSM. And yun nga, na-highlight din na hindi encompassing yung MSM sa mga identities na affected ng epidemic of HIV. Specifically na kami mga trans women, no, we don't identify to the term MSM. So ayun, hindi siya emergent. It's like it was just na surface lang siya somehow. And of course, it also provided us the opportunity to voice out ano ba talaga yung LGBTIQ plus specific health needs ng community natin. So hindi siya emerging. There's still a lack of attention. With that lack, I think less yung data at saka less yung research for our community. Even in the academe, no, hindi talaga siya nabibigyan ng attention, hindi siya palaging nasa study in the Philippine setting, in the Philippine academe, So ayun, I think there's really a need for us to know more of our health needs talaga. So we would really like, and of course, it also compelled us, mga LGBT advocates, to proactively demand to know more of our health, specifically for me, no, as a transgender woman. Even though alam ko, I'm aware that there is standards of care, but it's not yet applied in the Philippines. It's not yet, wala tayong guidelines, wala tayong regulatory body to implement it. So it's still absent in our health system, yung transgender health. Hindi pa din integrated yung reproductive health, no, ng LGBTs in our health system, because yun nga kakapasa din somehow 5 years ago ng reproductive health law. So we are still constantly advocating for our part in the implementation of the law. Tingnan din natin, no, kung ano yung reproductive health needs, as well as of course dahil na-highlight yung sexual health in the HIV program, tingnan din kung ano yung mga specific sexual health needs ng all of the identities, no, in the LGBT spectrum. So ayun, yun lang masasabi ko as the emergent health needs, kailangan siyang may attention na so that para lang mabigyan ng intervention, sapat na interventions yung ating community.
Right. Thank you very much. No, rich insights, no, from their first question pa lang. But yeah, you mentioned po, no, na it's not so much as yung health issues are emerging, it's that we don't really talk about them. And you mentioned something really important, no, na we need more research work on LGBTQIA plus health. And I guess this is a good time to ask, no, si Sir Laufred. Parang, Sir Laufred, what issues and phenomena, no, that are primarily being studied right now in relation to LGBTQIA plus health in the Philippines?
Well, basically, thank you for that question, and thank you, Magda. Very good input. And to respond to the question of Luis, there are a lot of research-directed issues and concerns of the trans community, the transgender, specifically among trans women. We are deeply looking right now on the health needs. What are the health needs? Nagkakaroon kami ng inventaryo insofar as the health needs of the trans women, because coming from Thailand, their trans women who work there is very good, and it's already embedded in the mainstream of public health. And there's a group there under the Thai Red Cross. They call it the Tangerine Project. It's a very good program all over Thailand, and it is governed and managed by trans women doctors, trans women nurses, trans women laboratory workers, etc. All governed and organized by trans women. Of course, what happens in Thailand not necessarily may happen in the Philippines, because there are certain social and political environment, that would influence. But the very first baseline that we need to do right now in research is look at their health needs of our trans women across ages and across social and political strata. That's a primary goal. Before we move up towards policy development, we have to have a baseline first. That's an initial undertaking that the university is doing right now. Over. Thank you, Luis.
Thank you po for that insight into what's happening in the academe, no? Yeah, I agree, no, na parang before we get to policy, no, magandang meron tayong information from the ground kung ano ba talaga yung issues, no? And I guess this is the important parang insight na we can get from Miss Martha because kanina si Miss Magda also said, no, na we have a lot of laws about health that affect the LGBTQIA plus community pero hindi pa siya na i-mainstream or na-integrate. So right now po, no, Miss Martha, what LGBTQIA plus health problems are priorities for policymakers at the DOH ngayon?
Yeah, so actually that's the perfect segue, no? Aside from the things that have been mentioned by Ms. Magda, no, the very apparent health outcomes like prevalence of HIV and AIDS, sexually transmitted infections, also very important, no, and hopefully this gets prioritized by the government. Yung sinasabi ni Sir Laufred, no, na capturing baselines or yung epidemiological data. Kasi as Sir Laufred mentioned, diba, in more advanced systems, maganda yung epidemiologic data nila. They know rates of non-communicable diseases among LGBTQI, communicable diseases, injuries, diba? Suicide prevalences, etc., etc. And sobrang helpful nun when we craft policies, no, because it makes the policies more responsive for implementation. Aside from that, no, because of the UHC Act, no, from siloed disease program implementation, we're moving towards systems thinking, no. So there's actually a lot of health system strengthening that's being implemented by the DOH, particularly how do you make sure na policies recognize GSC, having specific policies on LGBTQI health, no? Yung sinasabi ni Ms. Marta na on trans health, for example, also increasing the capacities of your health human resources. Diba? A lot of our health human resources are currently lacking cultural sensitivity, no, when handling LGBTQI patients. No? And at the same time, tayong LGBTQI advocates, kailangan natin magparami, no, so that we can advance LGBTQI health in the Philippines. And then lastly, mobilizing, no, and influencing communities for health promotion. So it's another priority of the DOH, and we're currently implementing mga social and behavioral change communications and campaigns like our hashtag our safely with Filipino Shell Foundation, yung Health is Life health promotion campaign, no. One of its focuses, no, are on sexual and reproductive health and violence and injury prevention. And then lastly, yung Consult Tayo or yung primary care campaign ng DOH, which is also focusing on the prevention of HIV and AIDS.
Yeah, a lot of things, no, important things, especially on the policy level, especially now that we're, in transition towards, health systems thinking. And you mentioned something really important, no, Martha, which is about collecting GSC information, which I feel like is a very, very important health parang concern. Not just for the LGBTQ plus community, but also for service providers, for policymakers, no. Parang right now, no, it's only the YAFs and the IHBSS ang nagko-collect ng SOGI information, right?
Yes, and we're also moving towards yung aming information system on injuries. We're hoping to have SOGI disaggregated there. data there. Kasi diba, we've enacted yung Safe Spaces Act that not only protects women and children from violence, no, but also gender diverse population.
Right. Yeah, yeah, definitely. I think that's a really important step forward, no? Because unfortunately, in recent years, no, parang mas nado-document. Of course, it's always been an issue, but in recent years, mas nado-document yung violence against queer people, especially trans Filipinos, no? And that's always been something in my mind na parang kasama ba to sa parang nag-analyze sila ng population level data, no? Na parang do they explicitly identify na this is a gender-related hate crime? But yeah, yung ganong like with the YAFs and the HBSS and with yung upcoming information system, do we need like a law for that? Like may kailangan ba may policy mandate for that?
Yeah, so for yung na-mention ko kanina na on violence and injuries, no, hindi na siya kailangan and we're actually utilizing no, yung Safe Spaces Act kasi ang framework mo doon is SOGI, diba? So that's already a good legislative instrument. But currently, no, yung other epidemiological data, in the current discussions, policy makers are actually raising maybe the need no for a law. And one of the ideas that we're exploring is kind of like tawag dito, making similar provisions in the SOGI bill dun sa ating Magna Carta on Women. Kasi it's the Magna Carta on Women that mandated sex disaggregated data. So ngayon, di ba, all of the sectors of government, nagko-collect na sila ng sex disaggregated data ngayon for policy development. Gano'n. So ngayon, the challenge to us is how do we expand that? And isa sa mga tinitignan namin is yung SOGI bill, no? But what I want to also highlight is hindi lang tayo basta-basta nagmamandato na okay, sige, kuha tayo ng SOGI disaggregated data, no? Alongside it, we really have to prepare our health workers and increase their cultural sensitivity because, SOGI is still sensitive personal information.
Yes.
And meron tayong mga members who are not comfortable sharing this personal information, diba? So, kailangan natin i-prepare yung mga health workers natin and the entire system so that when this data is collected, it's collected in a respectful manner and it will be treated with confidentiality, especially for those na hindi na comfortable disclosing that information.
Right, right. Thank you very much for sharing that. I really like na you highlighted na yes, there's a need to parang include it, to integrate it dun sa policies natin, but we also have to parang enact supportive mechanisms to make sure na yung information is handled respectfully, no, and to some extent even with confidentiality, no. And I was wondering, no, if I could get Sir Laufred's insights because Sir Laufred's done research for decades now. He mentors students, no, in doing gender and sexuality research, no. Sir Laufred, how do you approach po, no, collecting SOGSC information in your research?
We always go down to the local. The problem with SOGI data that we have, it is so metrocentric. So it's either we look at disaggregated data from Metro Manila, Metro Cebu, and Metro Davao, and the rest of the country are basically dataless. So we are going down to the basics. So we follow the lead based on the HIV, based on Republic Act 1111, which is the new HIV/AIDS prevention Philippine prevention law. We follow the established local AIDS councils. So sinasabay namin yun sa local AIDS councils, and this is mandated at the municipal level and city and provincial, eventually the national. Lahat talaga kailangan mag-establish ng local AIDS council. So kung saan may local AIDS councils, doon kami pumupunta para ipasok ang SOGI. So we're doing a backdoor entry in order to get data. But then again, We really need a very good clearinghouse. I don't know if it's in the university, in UP Diliman or in Manila, in terms of, or other universities who can join us too, in developing a clearinghouse of all those data, because baseline is very important. Kasi prior to the making of a policy, that would be a law, kinakailangan talaga magkaroon ng baseline so that it's easy for the authors, this would be the senators and the congressmen, whoever will author the policy, will have a very clear picture. No? The problem, there are several challenges though in doing so. Number one challenge, ang problema sa polisiya sa Pilipinas, kinakailangan yung magnitude malaki. Dapat palakihin muna ang HIV bago magkaroon ng batas. Kailangan mo nang palakihin ang dami ng COVID bago magkaroon ng batas. Kailangan palakihin ang TB bago magkaroon ng batas. Pero in my study, I'm a social epidemiologist too. Magkaroon ka lang ng isang problema. State concern na agad yun. Kasi yung isang yun, hahawa yan. Kaya if there is no early intervention, and prevention is a very good, early intervention is a good prevention, walang mangyayari. Kaya pag sinabi natin yung health concern ng trans women in terms of rape cases, okay, in terms of HIV cases, in terms of STI cases, in terms of NCD, non-communicable diseases, we don't have data. We're zero on trans women. And we want to produce that baseline so that we could estimate the prevalence and the incidence. May it be small, we still need to present it to the lawmakers. Ganyan ang ginawa namin sa Republic Act sa AIDS law, that we showed the politician the political side of the disease. Kasi hindi naman nila maintindihan yan medically eh. I can always tell them about the incidence and prevalence in a public health manner, pero they cannot translate it into political terms. How will it benefit them? How will it benefit the country? Second challenge, SOGI is very important, and of course it demands a lot of resources needed by the government. Ang rason lagi sa akin ng gobyerno whenever we lay down the policy guidelines on certain diseases, unang-una disease-oriented ang DOH. Sinasabi nila, Laufred, pagod na ang mga tao para mag-document ng HIV. Pagod na ang mga tao ng DOH para mag-monitor ng dengue, ng malaria, ng TB. Ang taga-taga na ng TB dot sa atin. So at the barangay level, pagod na ang barangay health worker. Ang tanong sa akin ngayon ng DOH, isasama mo pa ang SOGI. Isasama mo pa ngayon bagong batas ng mental health, isasama pa natin sa barangay. So there is really a problem in terms of human resources, health human resources, that can be afforded by the bureaucracy. Talagang magkakaroon talaga ng kapaguran at the barangay level. So therefore, what I could see, in spite of these challenges, ang pinaka-critical dito is the civil society participation. Like Magdalena's group. They are very important because what the government cannot do, the NGO will make it work. Kaya in our university, we are really giving a lot of technical work for our NGOs because the Philippines is known in Southeast Asia in terms of health. We are very good in civil society participation in health. We are a model, no, in Southeast Asia. Kaya I really congratulate. Look what happened to Magda's group with the legislation that they passed 2 days ago. That's really a big boost because sila nakaisip niyan, hindi ang gobyerno. Kaya maliwanag ang civil society participation. And if there could be some research and policy direction initiated by the university, we need to have a participatory action research involving the civil society as our partners in the development of policy and research. They need to be involved with us. Hindi na uso ngayon na nagsosolo-solo na. Ang UP ay dapat kaalyado nila as participatory action research and policy development, dapat co-author ang NGOs sa lahat ng bagay because they will be the one benefiting the program. Over. Thank you.
Yeah, thank you very much, Sir Laufred. Lots of very important points. No, I think one of the important points is that when we advocate for policies, it's important na yung stakeholder parang assessment and sort of ongoing discussions with yung mga stakeholders, especially like politicians and lawmakers. Um, Also important point no yung impact and implication ng mandating, for example, collecting SOGSE information on health human resources, lalo na sa barangay level. Kasi yun nga, sila nga, lalo na that we're transitioning to, or we're transitioning more towards yung UHC, no? Sa kanila talaga yung frontline work, no? And very, very important point is that malaki ang role ng community-based organizations, no? And this is a good place, no, to or point in our discussion to go to Miss Magda and maybe ask, no, because ang sabi nga ni Miss Martha that kailangan ng numbers when we talk about you know health problems when it comes to policy development. I was wondering, no, Miss Magda, maybe you could share, parang when you were advocating for yung mga SOGSC programs, anti-discrimination ordinances, natanong po ba kayo ng numbers? Like, ilan ba sa Cebu, ilan ba sa Mandaue ang LGBTQ+? How did you deal with that po?
Oo, ina-ask talaga yung mga numbers, no? And then of course, we're just a minority. So parang they take it less seriously yung mga cases namin. But of course, for us, it's really yung frequency kasi of the situation, even though maliit lang yung population namin, is very grave na, no? Na sentiments for us. So ayun yung case. But susugan ko lang yung kanina na yes, it's very, very important to really partner with the community itself, especially with the data collection, data generation, information, because yun nga, may cultural aspects din, perspective din yung community. Kailangan yung it's community-defined terminologies na hindi siya academician subjected by, yung terminology was just the the terms that were defined were according to the perspective of those who really studied us but not coming from us. So yung transgender itself was napasa-pasa lang yun because of the review of related literature, but somehow yun nga hindi nakukuha yung cultural perspective from us. Like for us trans women, no, in Cebu, we use binabay as a term to define us on the terminology that yun yung operational for us in the community. So yung application niya ng mga existing definition from outside, hindi siya nag-a-apply. So parang may gap talaga when it's really not the definition is not coming from our point of view. So that's one important. And of course, we need also to factor in na yung mga health needs ng LGBTIQ plus community is identity specific. Yes. And dalawa lang yung for at the moment, dalawa lang yung tinitingnan natin. Yung una is yung coming to terms with their sexuality, yung coming out nila na of course may mental health impact, so of course kailangan ng mental health interventions. Yung ikalawa is yung physiological health interventions or needs nila, no? Kailangan ng intervention, specifically of course reproductive health for those, hindi lang specific yung reproductive health for women, no, but also for men also, di ba? So iba-iba din yung layers because i-apply mo yung mga identities ng LGBTs, trans women. May reproductive health needs din kami, even if we undergo bottom surgery, etc. So, ang dami din, no? And sexual health needs din namin, yung mga sexual health practices and behaviors din namin existing. But anyways, na-studied naman na yan, no, because of the HIV program. But somehow, of course, kailangan end up din yung talaga yung collection of the data para at least magamit namin, ma-utilize namin for effectiveness of the program. Specific din yung transition needs ng mga trans people, no, and not just trans women, but wala talagang guidelines. We don't know kung healthy pa ba yung transition namin na ginagawa namin. So walang regulation, walang supervision, so super hirap. And then may layer pa on the age, no? Pediatrics for trans women na nag-transition or coming up to terms kung bata pa, ganon. Impact ng mga situation when for children who are out, nag-out na kahit bata pa sila. And of course, wala tayong mga response ganyan eh. So ayun, so yung adolescents nila, etc. Access nila to transition medication. Of course, given na yan, no, nag-worse of medicating, walang guidelines, etc. So ayun, second is the access to health services. My barriers because of discrimination, the non-recognition itself of LGBTIQ plus people, may cultural impact pa yan, yung mga negative perceptions towards LGBT people, immoral, abnormal, disorder, etc. So, eto yung mga barriers na we just don't want to interact, to engage with or access health services because yun nga, ito yung perceptions nila sa amin or even ganyan yung attitudes nila towards us. Meron ding deterrent talaga yung ina-act nila, yung mga biases nila towards us. So kailangan ng sensitization pa from our health service providers. So ayan, yan yung health issues talaga when it comes to LGBTIQ plus community, no, na somehow kailangan talagang i-confront na. Now is the time to really confront and take head on na we have to know what is really the state of LGBTIQ health in the Philippines.
Yeah, lots of great points. And that's really why we're hosting this panel discussion this afternoon, no? Kasi ang daming nangyayari with the community that hindi na itataas minsan sa policymakers or nangyayaring like nakikitang behaviors, mga na-experience na phenomena na document ng researchers na hindi na idadala sa policymakers or na ibabalik sa community, no? And I guess, no, like what Miss Magda said earlier, no, at the start is that a lot of these issues are already happening, whether or not we document them, whether or not, no, policymakers make a law to address it, no? So it's not so much as it's emergent, maybe it's invisible or invisibilized, no? And
Or neglected.
yes, neglected also, no? Because I think that's a really
Dead pa lang.
important term to use kasi may intentionality yung neglect, no? Na it ties well to yung institutional and interpersonal discrimination and harassment and prejudice. Miss Martha, earlier you were talking a lot about parang health systems issues that relates to yung LGBTQI plus health, like health human resource, yung paggawa ng laws, no, pag-integrate, no, or mainstream ng SOGSC into these existing laws. Are there other health systems issues that affect the community, but scholars and activists, they're not really aware of?
Yeah, so aside from minsan na-mention natin kanina, no, a really important systems component, no, is yung development of clinical practice guidelines for LGBT health, specifically for trans health and intersex health. Diba? As Ms. Magda mentioned, we don't have standards of care for trans people and intersex people here in the Philippines, in contrast with other countries. No? And so the development of CPGs would actually trigger a lot of systems components, no? Like, for example, another issue would be yung mga hormone replacement treatments here or yung mga gender-affirming hormone treatments here in the Philippines are actually being used off-label. Ibig sabihin, yung indication nila when they registered with the FDA is not specifically for trans people, diba? So when we actually develop those clinical practice guidelines, those standards of care, the market will actually see, no, okay, it's being centralized here in this country. And so that can be a trigger for, the pharmaceutical industry to actually register these drugs, no, for specifically for trans people, like in other countries, no. And also, yung mga clinical practice guidelines natin, very important siya, no, in the standardization of health services here in the Philippines, as Miss Magda mentioned, no. And I also share the same struggles, no, as a trans woman. Um, ang hirap, no. You don't know where to go when you want to access your hormones, diba? You want to be guided, pero you don't know where to start, diba? When you find an endocrinologist, hindi lang siya basta-bastang endocrinologist, kailangan very inclusive, diba? Or else you'll be discriminated, diba? And then when you now find, no, an inclusive endocrinologist, yung out-of-pocket expenditure naman, diba? Yung susunod na problem, hindi ka lang naman bumibili ng hormones, diba? If you pay for the professional fee of the doctor, you pay for the yung mga diagnostic labs mo when you're monitoring, for your monitoring, because aside from the hormones, ayun, diba? So, very important actually itong clinical practice guidelines natin because this is also a requirement for when government pays for essential medicines, for example. So when the DOH pays, for example, TB drugs, etc., etc., kasama doon, no, yung mga clinical practice guidelines, kasama yun sa mga tinitignan ng DOH. When PhilHealth develops, no, yung benefit packages, kasama dito yung mga clinical practice guidelines na tinitignan. So, I guess isa yun sa mga health systems components, no, na kailangan mabuo. First, no, with the medical professional societies, no, because they're the experts on this. At the same time, no, yung of course always yung involvement ng academe natin in terms of research, and at the same time yung mga community-based organizations natin, especially since alam mo yun, maraming research diba, or maraming the policymakers and the doctors or the health professionals only see one side, no, of LGBTQI health. That's why it's very important, no, to also bring on the table the other side, no, which is provided by your community-based organization.
Kasi kami yung guinea pig. Umiinom na hindi namin alam kung anong epekto.
And there's nothing, it's not the community's fault. That's what I want to highlight. It's the system's fault for not promoting this aspect of LGBTQI health. Kasi that's what we have to understand when we're changing behaviors of people. Diba? It's so easy to blame the people, but in reality, no, a lot of the things that the system can do, diba? Or there are a lot of things that the system should improve on in order to also improve, no, yung behavior ng community. So hopefully, no, well, in the next decades, no, when we build this, the trans community will no longer be afraid of subscribing to the health system, and they will be provided, no, yung rightful support, whether financial, no, or yung responsiveness of the health system when they access these services.
Yeah. Thank you for sharing that. No, you raise a lot of salient points, no, about yung parang health system side of things, no, because yun nga, like what you mentioned, a lot of it is really parang very healthcare provider centric, no, na wala masyadong healthcare providers na culturally competent and everything, no, but yun nga, like you mentioned, it's not the community's fault, it's the health system, no, that's really at play here. Kaya ang daming poor health outcomes for the LGBTQ plus community, maraming health experiences, no, whether issues or parang behaviors, no, na hindi nakikita or always represented in a negative light. And I think parang what's really important to note, no, is that you mentioned earlier na parang it's not just the availing of the services that's an issue, no, especially in terms of finances. Kasi especially in the Philippines, no, na 50% of health expenditures, it's out of pocket, no. What hindi na discuss na, for example, like with top surgery, and I found this out this week because I'm also doing research on trans health. It's like 150, 250,000 just for like the procedure and professional fees. Pero wala pa dun yung aspect ng transportation. And that's not just like taking a car. Minsan ang pinakamalapit to you is like sa ibang islands, ibang cities, ibang region, no? So there's that. Tas wala pang accommodation. But even that, that's just pre-op and op. Wala pang post-op, wala pang healing part, no, after the surgery. Miss Magda, would you like to share
I would
insights?
like to add na it's also because we are in a status quo. Yung status quo natin is hindi talaga nagre-recognize ng LGBT people. No, we are really
Yes.
yung gender binary, very patriarchal. So meron talagang non-recognition as well as of course na-invalidate talaga yung mga LGBT or taken less seriously because of the existing system that we have. And if we don't have a policy that recognizes the community itself, wala din. Kung walang mandate, wala ding nagko-compel sa ating government to provide these interventions. So ayun, and pagtingin nga sa mga investments for health interventions is yun nga, cosmetic lang tong mga trans women and also kapritsyo nyo yan so kayong magbabayad. So yan yung perspective because of yun nga cultural natin, political, social na status quo is ganito na we are invalidated of our status quo.
Yeah, and that's why we really see, no, na parang to get very important and essential healthcare services, trans women or trans people in particular, no, they have to parang subsume yung health problems nila into something else, no, na kunyari mag-try sila mag-claim sa HMO, hindi nila pwedeng sabihin na it's for transitioning. Parang labs lang siya in general, no? So that's really an important problem. And Sir Laufred, would you like to add insights?
Yeah, trans health is always a state concern. Let me start by saying that. It is enshrined in the Constitution that the state should always protect the rights of every segment of the society. Given that, I would like to redirect also that health is a developmental issue, meaning to say that it should never be seen as a sign of sickness and wellness, but it's a developmental issue. And I do hope that the incoming government, including DOH, who will be sitting in the Department of Health, should be able to look at transgender as a socialized problem, not a medicalized problem. Okay? Yun ang problema, and the university, my university, our university, Luis, is trying to wrestle with the Philippine government that transgender health is a socialized endeavor that needs a lot of research, that needs a lot of input from the community. And the community will be the trans community. And to understand why people behave the way they do. Yun ang basic question dun eh. If it's necessary for us in the university to do a longitudinal study, so be it. If we need to perform a quasi-experimental study in the university, so be it. If we need to have a policy intervention design, so be it. Basta may baseline tayo sa transgender community, I must emphasize that the incoming Marcos administration should see that trans health is a socialized, has a socialized perspective, hindi siya medicalized. Wag niyong ibigay sa akin ang continuum of care according to the insight of the medical doctors. Those continuum of care should be authored by the community.
Yes.
Not by the medical doctors. They can only be partners. But we always listen to the community. And I do hope that the Marcos administration should be able to have, bigger, wider ears to understand the transgender community, because at the community level, education is very important. We need to give them information about what transgender means. No? Para bukas at maliwanag ang kanilang matang kaisipan ng mga tao pag maliwanag sa kanila kung ano ang ibig sabihin ng trans community. Bago tayo mag-develop into something else, into policy development. Ang sa akin, I always follow what is the best way to do things according to the eyes of the transgender community. No one else. As
Yeah.
university people, we are only here to listen to them and help
Yes.
them and assist them. Because kasi ang university kasi, we do not believe in empowering other people. Mali yung salitang empowerment. We are not here to empower other people because the empowerment should be coming within the community, not coming from us. We don't have bags of tricks to empower the trans community. The trans community should be able to evolve themselves, make them stronger as a civil society, let them participate actively, and design what is best for them. And the university people can only assist them in that process, technically. Kaya go, Magda, go!
Yes, we deserve better.
Yes,
Yes.
Of course, we
yes.
acknowledge also partners that they have the expertise, and also because of course we are the beneficiary of that expertise. No, it's our health outcomes. So that's why we really are partners with this advocacy.
Yeah, and I
And to
really,
highlight also
yeah.
an addition from the HMO, the demand itself is that we would like to access oral contraceptives because yun yung alam lang namin na hormone transition na therapy. And we were excluded. We are denied of this because yun nga, walang existing na guidelines, wala ding alam yung existing na health service providers. So there's really a problem with the system na the absence of the health program, the intervention itself, the attention itself, na hindi talaga dinedma talaga is yun nga, or walang action. That's the problem. That's the problem there.
Yeah, and I'm really glad that both Miss Magda and Sir Laufred parang highlighted na parang issues with the system in terms of how they view trans health na parang we need to really critique and eventually move past the idea na parang lahat ng expertise is nasa healthcare providers, particularly medical doctors, na it's important na although yes, we acknowledge trans people or the LGBTQIA plus community as beneficiaries, dapat i-elevate din natin sila as co-authors, co-partners, in doing research, in policy development, in service provision, lalo na these communities, because they've been marginalized, they've learned to parang develop unique ways of accessing care, like yung Facebook groups ng mga trans community na malaking aspect siya of health seeking, for example. Or for example, yung mga Reddit posts na very informative, and to other healthcare providers, bakit, paano mo verify yung Reddit information? The community themselves verify that information. And so it's important na yung moving forward, like health systems thinking also changes the way that it thinks about trans health. And we've been talking a lot about yung parang sort of the importance of research in providing the necessary information to boost, for example, yung health system towards a particular direction that's more community focused, community based. And I was wondering, Sir Laufred, because in your experience with the IHBSS, your team was able to predict quite accurately that magkakaroon ng shift towards MSM. I was wondering na right now, with the research that you're doing or the research that you've been reading, are there any parang incidental or emergent findings on LGBTQIA plus health now we should be concerned about or starting to give attention to?
Uh, we were able to predict that there would be an explosion of HIV positives among the MSM community in 2004, predicting that 5 years from now, from that time, there will be an HIV explosion. It happened. But we only predicted it based on the figures that we have.
Right.
Okay, so the numbers provided us a very good scenario. No, if you are an epidemiologist or someone here is an epidemiologist, they know what I mean. That epidemiology, as the private investigator in the medical sciences, they would really be the ones determining. We are the ones determining that there will be an explosion or a stagnant or what have you, whatever the case may be. As to your question, what would be the other indicators? As of now, wala. Actually, first place, halos zero level ang aking information. I hope I could give you an answer on what would happen in the next 5 years. But then again, as an epidemiologist and an applied medical anthropologist, it's so hard to predict when in the first place, there is no figure to start off.
Right,
No,
right.
oo. But what is so glaring is that uh, there is a growing number of organized LGBTQI or even trans women's groups. And we need to solidify them and we need to meet them and hear from them what their needs are across political spectrum.
Yes.
When I say across political spectrum, this is the politics of health that I'm talking about. Across political spectrum, the ultra-right and the ultra-left, we need to sit together in order to present to the state, which is represented by DOH, to present to the DOH what kind of continuum of care is needed. Kaya we need to organize, solidify the ranks, so to speak, of trans community across political groups so that there could be, a clear understanding, a complete landscape of health. Yun ang hinihingi ng DOH actually bago sila gumawa ng polisiya. And I do hope that Magda's group could be able to group together across I understand it's so hard to put together all groups across political spectrum kasi may kanya-kanya silang political agenda. But that's the only way to do it. That's only how to diffuse it. That's only the way to define it. Kaya I would encourage the trans community here, organization to we want to learn from you and listen what your needs are. Over. Thank you.
Yeah, I think that's a very important aspect about advocacy work and activism na we really need to listen to people. Yung parang I think the metaphor is like from across the aisle. No, na we make an effort then to listen where they're coming from. No, baka kasi like I think in policy making circles, no, yung parang compromise is really an integral part of the process of developing policies, making sure that they're parang passed into law. And I guess this is an important parang this is a good place to maybe because we've been talking a lot about issues and problems, no, which is right now with the state of LGBTQ plus health in the country, marami talagang problems. But a lot of our panelists, no, I'm directing this to our audience now. A lot of our panelists are doing a lot of things, not to contribute to the solutions of all these issues. And I think this is a great way not to spend a little bit of time to talk about what each of our panelists are doing to contribute to the solution of systemic issues. And since a lot of our issues now are systemic, relating to the health systems, maybe this is the time for Miss Martha to share yung ongoing project nila of institutionalizing LGBTQ plus health.
Yeah, so this project really started as an idea for grad school. But I was very fortunate enough that I was part of the inaugural fellows of the STAMIA Sumo Fellowship of ThinkWell. So just a brief background, ThinkWell is an international organization that aids or helps developing countries in strengthening their health system. And the fellowship program was really developed to empower emerging leaders or emerging women leaders in global health. So I'm very thankful na when I applied, they believed, no, na as a trans woman, I am worth investing on. And so, tawag dito. So, in the past year, no, the work has essentially been diagnosing health systems gaps, no, through community interviews, no. So the project really started with me and my co-investigator, interviewing different members of the LGBTQI community. So trans women, trans men, gay and bisexual men, lesbian and bisexual women, intersex people also. So, and we've been learning a lot, no? And yung mga napag-usapan with Miss Magda, actually, nag-surface yung mga ganyang problems. And I would also like to highlight, no, very importantly also, the problems of the intersex community. So we had a very interesting conversation, no, about their lives, no, about their struggles, especially when, no, they go to health providers. Similar to trans people, yung problem na the doctors don't know what to do with them because they don't have the knowledge, no? At the same time, in discrimination that they face, no? Saying, or you're not supposed to do that because that's bad for your health, diba? Pero we know na the interventions that they need or the health services, that they need, no, is very important for them, no? So dun ko natutunan a lot of the medical terms, no? A lot of the also yung mga experiences nila, intersex people also experience gender dysphoria. Some of them would want to also undertake gender affirming hormone therapy. And then also the social aspect of it, no? Not shedding light to their problems, not having voices, no? And bringing them to policy circles, no? So very important. So the project really aims to, provide policy recommendations for the DOH on how to strengthen yung mga universal healthcare initiatives natin, no. So as we speak, no, and since 2019, the system is really undertaking a huge reform, no, in order to provide, no, quality and affordable health services to all Filipinos, no. So the keyword there is to all Filipinos. That's why we always, go back to that North Star, and even if we don't have, a specific legislation, specifically for LGBTQIA health, lagi naming nilalaban here in the DOH is we won't be able to achieve universal health care if the LGBTQI community is left behind, no. So after that process of talking to communities, community organizations, and the actual community members themselves, no, we're now in the process of co-creating this naman with the Health Promotion Bureau. Particularly because in recognition that LGBTQI health problems are not only within health systems, no.
Yes.
It also involves other sectors, no. And the Health Promotion Bureau actually employs a whole of government and whole of society approach na in terms to health promotion. So we have collaborations with the education sector, with the labor sector, and also the welfare sector, recognizing na education, employment, and social welfare are social determinants of health, and very important that we address problems on this, no. So now we're co-creating it with the Health Promotion Bureau. Tawag dito, kumbaga parang seeing currently ano yung mga initiatives nila and how we can actually integrate, LGBT health in their existing initiatives. And also seeing ano pa yung mga pwede nating simulan, no? And so after this co-creation workshop, as the fellowship actually ends in August,
Mm-hmm.
what I plan to do is to come back to the community, no, and actually present to them, no, what has been the product, no, of essentially their stories, no, and how it translated to policy, policy action, no. So I echo yung sinasabi ni Sir Laufred, no, na it has to be them, no, who's authoring these policies, no, because it impacts them, it impacts their lives, no. Um, and it shouldn't only be, no, the policymakers at the central level who are writing this, no. That's why I really want to have that workshop with um, the communities and the individuals that we've engaged with, but also to other communities, no, who are in this webinar, who will be interested in participating in that workshop. So the work won't stop, no, by in August, no, by the end of the fellowship. It's actually just going to be the start, no. So a lot of policy, work, no,
Right, right.
in the Health Promotion Bureau, and at the same time, a lot of capacity building that needs to be conducted internally, no. So lagi ko nga sinasabi dun sa mga taong kausap ko in Health Promotion Bureau, no, from from only a team of two, which is me and my co-investigator, we're now expanding to a team of 7, and then the whole bureau, and then eventually, no, when we when we shed light, no, or when we push for LGBTQI health to the other bureaus, no, inside the DOH, mas magkakaroon ng mas mataas na kamalayan yung ating mga policymakers,
Right.
mga program implementers. And then also, yung other sectors, no, of or other national government agencies will also help us.
Right, right. Seems like you have a lot of work that you've already done, no? And it's really personally, no, when I first learned about your work on institutionalizing LGBTQ plus health at the DOH, no less, I was very excited. Because apparently for me, I thought that was years pa, decades, no, into the future na baka hindi ko pa nga siya ma-experience. But I'm really glad na in such short time, you've, made so much progress already. And parang sana yung mga plans mo is matuloy, no? Because ang daming matutulungan, no? Just the act of like bringing back to the community yung
Yeah.
findings nung project mo. That would be a big deal, no? And everyone in the webinar, like Miss Magda, Curls, no, other participants, so I hope you can join yung workshop
Yes.
ni Martha in the future, no? So we'll help you plug that in the future pag nangyari. Miss Magda, no, you recently passed yung SOGSC legislation. What's next for Curls?
Yes, actually yung Curls yung ginagawa niya is nagpo-provide like for example HIV prevention, so information dissemination, sexual health education, SOGSC education, no, sa community, as well as of course health service providers. So partner talaga kami ng government, so hindi nila na-feel. So we are filling the gaps, no, kung ano yung kakulangan when it comes to reaching out to our community. And ayun, other than that, we also provided the demonstrative practice, no, kung ano yung ginagawa at saka ano yung also yung data generation when it comes to LGBT information is kami rin yun. We are helping them reach out also the fellow members of the community para lang for us to generate the necessary knowledge, no, to inform them in their interventions and of course the policy that they're going to formulate in the near future. aside from that, we also advocate or lobby policies that is affirmative also, and to push for the health agenda of the community. Actually, in the ordinance that we lobbied for the LGBT Code of Mandaue City, meron kaming nilagay na provisions on integrating LGBTIQ plus affirmative health interventions in sexual and reproductive health programs ng city, as well as another provision on trans health. So yung challenge na lang namin is how to implement those provisions. For the SOGIE Equality Ordinance ng city naman, pwede naman siyang an opening or an opportunity for us to advocate for yung health, no, LGBT health, kasi it's more likely a development program. So at least may budget, maybe health promotion will do, maybe pwede mag-reinforce ng information dissemination when it comes to LGBT health in barangays in partnership with the City Health Department of Cebu City. And of course, continuing yan yung lobbying ng mga policies or replication of those ordinances in the whole Cebu province, as well as yung mga LGUs in Region 7. So binibigay din natin sa mga other LGBT advocates para ma-replicate din nila sa LGUs nila. So yun yung mga ginagawa natin. Of course, we are also involved, no, at the national level. At the moment, dangal Pilipinas and a network of MSM and PG network representing the MSM and PGs. We are also partnering with the Protax project at the moment, and actually na-review na namin yung transgender health framework, and then after that we're going to utilize how do we go about in operationalizing this PG health framework. So kailangan siya advocate para ma-translate siya to transgender specific health package to be utilized in the HIV program, or somehow make use of the transgender health framework as the core or the foundation of transgender health program to be integrated in the health system in the Philippines, or make use of the transgender health framework to be for the trans people to be included in the UHC implementation. So it's really a big advocacy, no, for trans health lang talaga. Yan yung mga namin engagement at the national level. For sexual and reproductive health initiatives naman, parang hindi kami masyado na-engage. But of course, because of sexual health, HIV, baka somehow may mga opinions sa amin din. Ayun. And of course, constantly community system strengthening with, of course, with our other CBOs na part ng network.
Yeah, a lot of upcoming projects and ongoing projects for girls. I really like, no, na parang naging intentional yung curls about making sure na sa recently passed ADOs ng Mandaue and Cebu, explicit, no, yung parang provisions for health, and not just that, na affirmative provisions, kasi yun yung kulang in a lot of our anti-discrimination ordinances. A lot of it is preventive pero walang affirmative na provisions. Finally, no, maybe we can get Sir Laufred's insights. Sir Laufred, what's next for your project? I know you're working on trans women and stigma. What's next for your project, sir?
Well, presently, thank you, Luis, and congratulations, Martha and Magda, for your respective work. Very impressive. Insofar as our team is concerned, in UP Manila being partnered with Brown University, we're doing a 2-phase study on trans women's health. The first phase is about to finish 2 months from now, and that involved us in deepening interviews, lived experiences, narratives of sorts of trans women in Metro Manila. So we're interviewing 25 trans women across occupational groups, across economic strata, insofar as they're transitioning process, lived experience. So you could imagine that this is a qualitative exploratory study design, and the data that we are collating are taller than us, taller than me. We are not yet in the writing space, but you could just imagine the data that we have gathered over there. That's phase one. Included in the phase one too is a systematic analysis and systematic synthesis of the health intervention designs globally. What works best for trans women community? For example, if one will need to compare in Cuba, which is a socialist country, compared to the United States of America, which is so-called democratic federal system. So we are looking at that angle because the phase one study indicators would include the issue of healthcare for trans women in terms of equity,
Right.
in terms of availability, in terms of accessibility, in terms of affordability, accessibility, availability, and acceptability.
Right.
Kasi we need to look at those services using those study indicators, because fact, Luis, that we have more than 100 ethno-linguistic groups, and each of the linguistic group has its own healing practices, even among the trans communities. So it has to be culturally prescribed, culturally accepted, and language appropriate for any kind of services. That's a big task. That's only phase one. And the phase two will continue until next year, and this will now involve the design of the appropriate telehealth, and not telehealth, it could be telehealth or trans health for trans women, hoping that we could possibly have a design and a program and run it for the next 3 years, try to evaluate it, and hoping that we could mainstream it for the rest of the country. So we're starting off with NCR. So
Wow.
so that's it. The research. In short, we're contributing to the baseline data of the country on trans health of trans women.
Yeah,
Okay.
that's really exciting. Oh, ang daming parang data points for that one study alone, no? So it's really exciting that that's ongoing, and that will, there'll be an opportunity for everyone in this webinar to contribute and be involved. I guess this is the perfect time to open the floor, no, for questions. We actually already have one from Sean Kim. No, they would like to ask Professor Hernandez, no, what they think will finally cause the government to make the necessary changes or reach a breaking point to finally address LGBT health issues.
Well, first of all, there should be a clear acceptance by by the incoming political dispensation in terms of UHC, the needs of the trans community. I'm not only talking about the trans men, but also the entire trans community, including LGBTQ, of course. There should be a clear acceptance by the incoming political dispensation that they have the right to be included, not excluded from the UHC, so that they need to be in the framework. That's the only way to go. So there should be a solid voice coming from the community, put their acts together, and let's support them.
Yeah, agree. No, we need a really strong parang front in the upcoming administration, lalo na yung stance nila on the LGBTQ plus community and their relevant issues are quite uncertain. Thank you for that insight, Sir Laufred. If you have for the audience members, no, if you have questions, please send them to our Q&A feature, Q&A chat box, no, so that we can share them with the panelists, no. So while we wait for some questions, I think a really good question that our panelists can ask, no, is the panelists can answer, no, is how do we get involved, or parang how do we parang break into like policy making, community advocacy work, or research, no, for LGBTQ plus health? Maybe we can start with Miss Martha.
Yeah, no. So as I mentioned, no, it's not only the work that I'm doing, no, on creating that hopefully policy, on the promotion of LGBTQI health. We also have a lot of policies, that are undergoing development. No, a good example, I think, would be yung development ng health promotion framework strategy ng Health Promotion Bureau, which actually involved, in the development process yung LGBTQI community members natin and the organization. So, on the government side, siguro practically, ang sasabi ko lang is never, para huwag kayo matatakot or huwag kayo mahihiya to dito, approach the government, especially now, it's not only me actually who are members of the LGBTQI community in the organization, we have a lot of members, who feel strongly about LGBTQI health work and also great allies, and so I believe there's increasing openness, for collaboration. Also, the Health Promotion Bureau is actually developing, a fellowship program. It's called the Realizing Equity Through Sustainable Health Action, Participation, and Empowerment. So it's the Reshape Fellowship Program. And one pillar of it is capacity development. So it's going to be a 2-year program. I believe it's in partnership with UP Manila, College of Public Health. And they are getting 16 fellows, who will conduct participatory action research. And one
That's
of the
CAS, Marta. It's CAS, College of Arts and Sciences, not Public Health.
Okay pala. CAS pala, sir. Opo, yan. So, this is a great opportunity, for community members, to actually participate, in a government-funded fellowship program that will enable them to do participatory action research and at the same time, translate that action research into policy initiatives.
Right, right. That's exciting. So many things pala, so many parang pathways to be involved in policymaking. We only have 2 minutes, but I really want to get Sir Laufred and Miss Magna's insights. Sir Laufred, how do we get into LGBTQIA plus health research?
Well, paano nga ba? Sa research kasi may issue ng relativism eh. Meaning to say, do you need to be an LGBTQ or member of the community in order for you to undertake the research? Is that an upside or a downside? Yan ang unang-munang tatanungin. Kasi if you're an LGBTQ and you know the issues very well and you want to translate the research, it into research, baka ang tendency naman ay you are already doing a self-assessment report instead of a group paper report. Yun naman ang problem. That's a downside. But if a non-LGBTQ member would look at, you know this, Luis, from a ethic point of view, from an outsider's point of view, it could be more objective, it could be more at a distance. But the important thing is that you always consult the EMIC, the inside point of view of perspective. So I will always throw the same question to the person who asked that. Assess yourself. How to a certain extent that you can really help the community. Is it a personal gain? What is it for you, and what virtue or values you want to impart for the community? I do not prescribe, I do not recommend, but you have to have a self, assessment of what you really want to do. But of course, you want to help. We want help and assistance from everyone. We cannot deny that.
Yeah, yeah. I think that's a really good point. No, so if you're interested, no, you're an audience member and you're interested in getting into LGBTQ plus health research, you have to ask, no, why you want to do it, how you want to do it, no, and if you're the right person for, the undertaking. I think there's no better way to end, the webinar by asking Miss Magna, now, how can we be more involved in LGBTQ plus advocacy and activism?
Ayan, so yung masasabi ko lang is there's nothing about us without us. So kailangan talagang yan yung pinaka-priority natin if we want to engage, to be involved in LGBTIQ plus health. Because of course we will be actively participating because yung purpose natin is really to improve the health situation of yung community. So kami namang mga LGBTs, we are really actively participating in all of initiatives that will really benefit us, benefit the LGBT community. So ayun lang, we will be partners with you, partners in health. So ayun yung same then yung with the Department of Health, the partners in health. We are also partners in health with all the stakeholders in society. Ayun.
Yan, maraming salamat sa ating mga panelists. No, unfortunately, we do not have more time to answer questions. But if our panelists could put in the chat, ways that the audience can sort of reach out if you have further questions or if you would like to partner, for LGBTQ plus health, the panelists can share those in the chat. But yeah, let me just take this time to express, through the center, our appreciation to our panelists. Maybe we can share yung certificates now, Miss Jasmine.
Oh, okay. I didn't know that we were gonna flash it. So
Oh, okay. I have
just-
it. I have it. I have it. So let me just share my screen, no? All right. Is my screen visible? Ay, parang hindi masyado. Ayan. Can everyone see my screen? Yes.
Yes.
Right. Okay. So let me just read now the citation. So the UP Center for Women's and Gender Studies presents this certificate of appreciation to Professor Laufred Hernandez, Martha de la Paz, and Magdalena Robinson in grateful acknowledgement of their invaluable contributions as a panelist for the State of LGBTQIA plus health in the Philippines, a panel discussion on policy, advocacy, and research held on June 24, 2022 via Zoom. Ayan, maraming salamat po sa ating panelists, maraming salamat sa ating mga participants, and happy Pride, everyone!
Thank you. Happy Pride.
Happy Pride!
Pride. Ayan. So we'll just, we'll stop the recording now.